I'm here with a client who's had originally a traumatic injury 10 years ago, and then subsequently the metal work that was put in there to help the fracture heal, which the surgeon had originally said should be removed, but the medical team that she subsequently saw wanted to leave it in situ, actually over the decades clearly moved around a little bit and actually ended up severing one of the tendons coming up to her finger. That happened in May, and then it took until September for her to be able to actually get some surgery and to have a clear diagnosis of what had occurred. So we've got an original small scar which was then reopened and made larger during the subsequent surgery, in which they've reattached the tendon. So these two fingers have now got sharing a tendon, and so we've got a small scar which is visually really beautifully healing here. The scar which is a little bit larger here still looks a little bit pink, but we're only just at 8 weeks. Really on a good rehab program, doing some great exercises with her team. We've done a little check-in where she is with her kind of colour progression, and obviously if you keep an eye on how the colour's progressing, that can be a good indicator that the scar's kind of going through maturity, as you would expect, and it can be quite hard to document those different shades as you move through. We've got a lot more density on this scar, and certainly when she goes into flexion through those fingers, what we're finding is that she's really feeling a pull down into this upper scar. I've done a few minutes of manual massage, and now what I'm going to do is try the 60 Action Pro machine, which is a negative pressure machine. So what it's going to do is just create some suction through that tissue, together with there's a little bit of sort of vibration that happens through the tissue again. We can absolutely control the pressure and the frequency of the lift and drop. With newer scars, I think it's really nice to start with quite a quick pulse, so the tissue isn't held up for too long under too much strain, and then as you work through a treatment program, holding the tissue up for longer as that becomes more robust. Obviously, holding the tissue up for a short amount of time puts less strain on the tissue and should be more comfortable to receive, but it really gives quite a good stimulation to the area. At 8 weeks, the scar's still quite delicate, so we're going to work on lower settings. Probably start around about 50 megahertz of pressure. The pressure will also be dependent on the size cup that you choose. So the same amount of pressure with a larger cup will feel stronger than using a smaller cup. So we're going to start with a fairly small cup today. So I'm going to start with this cup. I'm going to work around the area and then onto the area. So you just attach on the cup of choice onto the machine. You've got two little buttons on the first here. The first one is to control simply the pressure. So if you wanted a static pressure, that's the only one that you need to choose. And then you can change the settings, turning the pressure up by just twisting the dial round. And then the second one, dial on the right hand side here, is the pulsation. So going from a very fast pulse at the far end to really quite slow. So that's how long it spends drawing up and letting go. So I'm going to move that towards coming up towards 1.5. I'm going to start away from the scar and then move in towards it. What's really great about the 60 Action Pro is that you have so much variety of shape and size of the cup head, so it's really good if you're working more around an area like a hand, because you've got so many different choices of different sizes. So just coming onto this underside scar. How does it feel on the scar?
Fine.
Yeah. So stay in each place, give it a few pulsations before kind of moving on. Check in with the client, any discomfort. Obviously visually with the clear cups, it's very easy to see and be able to tell if there was any kind of irritation going on in the tissues. If you've got very, very tight skin, so if you have a lot of swelling, you can always bring the tissue into a little bit of tissue ease. So actually sort of bringing into a little bit of flexion here, just so that I can actually have a little bit of soft tissue to kind of pull up into the cup, just working to the side of the scar as well. And turn it down, just come across that more sensitive area here. So I've left the same pulsation but slightly reduced the suction, just to work over this area which more recently had that tiny little bit of stitch that hadn't dissolved, that was supposed to dissolve. So doing around about 6 to 8 pulses in one place and then moving off, checking visually with the colour of the tissue. It's normal, it's going to create a vascular response, so you are bringing blood up to the surface of the tissues, which can help promote healing. But equally, if I felt that it was really going very, very red, I may want to turn down the suction if that was getting too uncomfy. If you are concerned that maybe you've done too strong a suction and the area is looking very red, I would simply stop. Obviously you can test heat, because if it was getting very irritated you'd start to feel some heat coming through, and then you want to just see how quickly it goes back to normal colour. So if you found maybe you'd put it on in one place and there was a big red circle where you'd be working, then I would definitely just leave that to kind of calm down rather than keep persisting with it. While I've got this cup size on, although we can't see an injury through here, we know that it's gone trauma on the other side of the hand. So we're working here on further away from the injury site. I'm going to turn up the pressure. I'm going to turn down the pulsation, so it's going to feel a little bit stronger, but not much, and just work through here. I think I can turn that up slightly. So I'm going to go up to around about 80 millimeters of mercury. The pressure for this device, and just relax that tongue, relax it, is measured in millimeters of mercury. How does that feel through the underside? Nice. Pleasant. And this is just, you can feel, well, you can't feel because you're watching, but as the machine is working, in addition to the suction happening, the end of the cup does a little vibrate, so there's a little bit of oscillation happening in addition to the suction and release. And with my hand on the back, I can feel the vibration coming through, so I know that I'm working the underside of the scar, and that'll be really nice. Vibrational techniques can really help with the drainage. The oscillation through the tissue really helps to promote drainage after trauma, and just can be a really nice neural stimulus as well. A lot of people who have a lot of pain find actually that this technique can be quite well received and help with that kind of pain and discomfort. I'm going to turn those both off for a moment. So just before you do anything different, just check in whether or not that was helpful. So just move that hand around a bit, just see how that's feeling. Just some nice kind of big stretch out and close in. Tell me how that feels. You might not necessarily get any more closed, but what I'm interested in is kind of like the quality of the feeling. I haven't yet come through this section, so I'm interested in if things feel a little bit easier through.
It feels easier through there.
Definitely. Yeah. So I was using the smaller size cup, but we can go up in increments and we go to really quite large cup. But I'm going to go even smaller and use one of the glass cups. So to swap the heads, you just push on and then you just put a little bit of pressure on this little ring on the end, and then you can unhook the head. So it's pretty straightforward. So I'm going to change that, and then this comes with some teeny tiny little cups. This one can be used in both ends, so you could do a very, very small scar. So for example, if you had some surgery around the eye and then a slightly bigger scar, and I think this is going to be a perfect fit for working over the hand. This comes with an extra bit of control where it's got a little air hole here, so that you can press on that in order to create suction. Particularly if you're working around the face or the eye and you wanted to be able to quickly release, you simply let go, and so it means that you're not attached onto somebody's eye. The difference is you can slot it into this head then in different ways, so you can push it in that way or put it in that way. So we're going to use the slightly larger of these two ends. Nice firm put in, and then we can simply plug that back in. And we're good to go. So with a small head, a lesser pressure will feel even less strong. So the smaller the head, the more, even with the newer scar, you can incrementally increase the pressure. So I'm going to start around about 40, 45. I've got really quite a fast pulsation happening on the scar, on the lift and drop. And I'm just going to come in underneath. So you hardly see that going up at all. So I'm just going to put some vibrations through that. It's more like a vibration. And just start to oscillate the tissue like that. And just hold it on the areas that you want to work for a little moment. And turn that down slightly. And here I can really see that normally within the cup you'd get an even lift of the tissue, so it would come up as an even curve. And I think the client will be able to see as well with this, when I come onto the scar, the nearer it is the actual suture line isn't really lifting up, and it's on the edge of the cup that we're actually getting more of a lift. Can you see we've got a lot more tissue movement on the edge? So just try and place the bit that isn't moving as centrally as possible within that cup to really get that to be the bit that lifts up. Sorry, I didn't put that in firmly enough. Any difference in sensation with this little one?
Yeah, it feels different, but...
prickly at all?
No, not at all.
I wouldn't be surprised if a cup like this in some individuals might make them feel a little bit kind of prickly, just because if there was kind of like neural recovery happening under the area, that can give a kind of tingly, prickly sensation. If it was worsening with as you held the treatment, then obviously I'd stop immediately. Otherwise you could just turn the pressure down, change the pulsation and check in with the client, or perhaps it's just not ready to tolerate the techniques. Yeah, I don't know if you can see, but this here is really not moving very much. And it's actually off the scar a little bit. It's more to this side. You can just see the tissue possibly inside the cup just pulsating. We've got an area that really doesn't want to move just over that central bit. So we've got, I can see like the back part of the cup has got some movement in it here, but it's actually not coming through this area here. And you can actually see, although it is quite hard to detect edema in the hand compared to other parts of the body, but we have got a little bit of mark left where the cup's been pressing on, and so that's obviously a little bit indicative that we have got some fluid build up under the tissues, but it's just such a small bit of tissue. Because we've got the really very specific area that doesn't want to lift up, I'm going to go with the very smallest head now, and then we really won't see very much happening, but it will just mean that we can get some targeted treatment onto that. Might turn that down a bit, turn that up a bit. So again, I've gone to a smaller head, so I'm going to turn down the pulsation and turn up the pressure. Work very specifically over those areas, and if I take my finger off, then I totally lose that suction. So this kind of small head you can work very specifically. You can also completely turn off the pulsation and then do a little kind of static pressure around the area, so that's just lifting up and mobilising the tissues and creating a little bit of suction around those areas. Feels nice and mobile having done that work. The glide feels better. Have a feel yourself. I'm going to do a bit on the underside as well, but it feels like it kind of moves about a bit more normally. So we've still got like that bit of stiffness. If I kind of try and bring the tissues together, we've got kind of like that density hasn't immediately changed, but the glide here is much nicer than it was before I started with that 60. So that's nice to see how that's changed.